I was a reporter for the Philadelphia Inquirer, and I came across this little story about a lawsuit that was being brought by hemophiliacs against the blood products industry. And so I called one of the lawyers. He told me, he said, if you stick with this, if you really dig into this, it's going to be like nothing else you've ever covered.
Someone should have said, there's a danger here.
This was one of the largest medically induced epidemics in the history of this country. How could that have happened?
Pharmaceutical companies, the doctors, the FDA, the government, they had the knowledge. I don't know what their intent was, but they had the knowledge. They failed to warn us. They failed to warn us.
In pharmaceutical companies, profit drives research. It's a wonderful thing, but never at the expense of safety. That's kind of what got lost here, and it can get lost again. It's too easy to get lost.
When they came to my parents and they said, one of your children has hemophilia and one of your children does not, they said, well, we knew it was you because you were always bruised and battered by doing nothing.
We would always have to rush him to emergency rooms. We got to know almost every hospital emergency room in New York City.
I remember when he was about 8 and he hurt his leg. His leg looked like a watermelon. And it was just, no matter where he put himself, it was just the pain, because the pressure of it. It was a lot of pressure on this little person. It had to be excruciating.
Born in 1971, Matthew Kleiner escaped hemophilia's darkest era, a time when no treatment was available and patients rarely lived past their teens. By the 1950s, crude treatments meant children survived, but it was a very difficult life.
Hemophilia is a blood clotting disorder. It's a very large misunderstanding that if you have a little cut on your finger, you're just going to bleed to death on the spot. That is not true at all. The major problem in hemophilia bleeding is internally. That's where the crippling manifestations of hemophilia make themselves felt. Bleeding in the knees, the ankles, and other big joints. So life was really hell.
When you have hemophilia, you're more likely to bruise. And so I would have these big purple and black bruises on different parts of my body. And when my mother took me to the store, she would get very angry looks from other people, especially other mothers, because they drew the conclusion that she was hitting me.
These boys wanted to do what all the children around them were doing, to run, to play on playground equipment. And many times it was hazardous, even though it didn't look hazardous, and brought on bleeds.
Sometimes slowly, sometimes very quickly. The pain goes from dull to acute to, and in its worst form, it's really a kind of a torture. And it can go on for hours and hours, even days. Your mind shrinks to a very tiny space where all you can think about is how to get to the next second, and then from that second to the next second after that.
Hemophilia is caused by a genetic mutation and is usually passed from a mother to one or more of her sons. People with hemophilia have low levels of one of two clotting proteins found in blood, called factor VIII and factor IX. The degree to which this protein is absent determines whether a case is mild, moderate, or severe.
I had two boys with hemophilia. It's very upsetting when you find out that your child has hemophilia. Leo was born in '58. He did have quite a number of bleeds, which eventually destroyed a lot of the bone. The blood just eats away at the joints. And he went through the first years of his life getting whole blood as a treatment. And it had very little impact on a bleed.
I sometimes wondered why I kept treating these patients because it was so frustrating. One never had a patient who got well.
Doctors struggled to treat patients with whole blood. Then they tried plasma, the golden yellow part of blood. But for patients, it still meant prolonged, excruciating pain. Then in 1965, scientists extracted a more effective therapy from plasma. They called it cryoprecipitate, or just cryo.
I spent about a third of my childhood in the hospital. One of the first times that I got cryo, I was probably 11 or 12. And I went in because I had a cut on my tonsils, probably from some food that I ate. Previously, that might have meant a prolonged hospitalization for a period of 2 or 3 weeks. But this time I went in, I got cryo, and as soon as the infusion was done, I can remember looking in the mirror with a flashlight, and the bleeding had stopped.
Still, it took as many as 15 bags of cryo to stop a bleed, and the inconvenience of a hospital stay. But in 1966, scientists made a breakthrough. Isolating just the factor proteins from cryo, they created a concentrated treatment that could control bleeds in a single dose. To grateful patients, it was known simply as factor. As the pharmaceutical industry began the mass production of anti-hemophilic factor, their manufacturing and marketing capabilities promised treatment for all.
It was a revolutionary, transforming advance in medical treatment. If your knee tingles, or you fell down, or you bit your lip, something like that, then treat.
The product was even marketed for home use, to be stored and infused by the families themselves.
I could mix up the factor and infuse it in a matter of minutes, and I took it to every conceivable kind of place, and I did shots in every conceivable kind of place, including the bathroom of airborne planes. So I could go anywhere.
Both of my sons were severe hemophiliacs. Every time they got excited or every time they got stressed out, if they had tests in school, they'd bleed. And they missed a lot of school for hospitalizations. So it was almost like a miracle drug where you said, oh my God, it might cut down on at least Brian's half of his hospitalizations. Sure and heck, Sean never went in the hospital for anything. It was totally controlled at home.
Hemophilia was called the chronic illness success story of the decade. The benefits of the factor enabling these little boys who had been in pain and who couldn't walk and who couldn't go to school and who couldn't play sports to suddenly be able to go to camp, to play games, to go to college, graduate school, get married.
4 companies soon dominated the U.S. market for factor concentrates. The patient population was small, about 15,000 individuals in the U.S. and about 400,000 worldwide. But 7 out of 10 cases required frequent infusions, costing thousands of dollars per year.
It quickly became apparent that the clotting factor concentrates were going to be enormously profitable. Today, that's about a $6 billion a year industry globally. For the patients, it meant that their well-being was no longer something just between them and doctors. It suddenly became something that was very much the business of business. And that changed the complexion of their treatment in really dramatic ways.
I mean, my hepatitis level's probably pretty high.
Does that hurt a little bit?
Yeah.
Almost universally, all the patients became infected with hepatitis B who took these products within the first 2 or 3 doses.
Does that hurt?
Our relationship with the doctors was such that you really didn't question what we were being told. As a 10-year-old, my parents were sitting there saying, how can we make our kid better? You know, this is a product that's going to make my kid better. Okay.
Hepatitis is a virus that attacks the liver. It was present in nearly every vial of factor, and it was transmitted through blood plasma. Huge quantities of plasma were required to manufacture each dose of factor. In search of donors, for-profit blood banks began offering cash for plasma.
The plasma centers were owned by the pharmaceutical companies. These centers were licensed by the FDA. There were centers located in parts of the cities that would be described as skid row locations. And the donors were typically transient, poor. Going to paid donors has always been understood to be a high-risk venture, because when you pay someone for their plasma, they have a motive to lie about their health because they need the money.
Because the products that were made from plasma could not be supplied out of the volunteer blood community, and still can't to this day, paid donors were permitted for commercial companies like Highland and its competitors. There was blood collected in foreign countries. There was also plasma collected in prisons.
Each bottle represents the plasma sold by one man for $5.
Companies initially were using plasma collected from 40 to 60,000 donors, putting them into a vat and then processing it so 1 or 2 or 3 infected donors, which would be expected in a donor pool of 60,000, who had a blood-borne disease, would then suddenly infect the whole pool and thus infect all of the patients who received that material.
But companies insisted paid donors and pooling was the only practical way to meet patient demand, and the regulators allowed it.
The regulators were told, if you put any more restrictions on us, you're going to make it impossible for us to treat these patients, these hemophiliacs. So the government was under enormous pressure to let these products be sold.
This was a long time coming because they could never get the factor VIII molecule to hold still long enough to let anybody put it in a bottle and dry it. This was a breakthrough that was like flight. And I think that nobody would make the judgment, oh, we must wait until it's safe.
Everyone knew that factor VIII concentrates could transmit hepatitis because it was just assumed that this was one of the disadvantages of any product made from blood.
A severe hemophiliac who would infuse clotting factor concentrate maybe once a week, so say 50 times a year, would easily be exposed over the course of a year to the blood plasma of literally millions of donors. And I'm not sure that the patients really understood the implications of using these clotting factor concentrates the way the companies did.
One would think that the logical next question, given the fact that it was widely accepted that there was hepatitis in these products, if hepatitis was in there, what else was there?
The disease seems to begin with recurrent fevers, swollen lymph glands, loss of weight and appetite, and a general run-down feeling.
Acquired immune deficiency syndrome, or AIDS, was first identified in 1981. No one knew what caused it.
I first heard of the possibility of this new disease in a patient with hemophilia in early 1982.
As AIDS cases among hemophiliacs climbed, CDC scientists became convinced that AIDS was bloodborne. This devastating theory meant anyone reliant on blood was in grave danger.
It was a moment that had to be dealt with, we thought, very quickly. During that period of time, we were on the road working 16, 17, 18-hour days, trying to identify what was going on. Information was accumulating so quickly, and so we had many, many nightmares. It was an extremely stressful situation.
Bruce Abbott from the CDC came and talked to our clinic. It is a moment I will never forget because I had a lightning bolt go off that in my heart, really, that I thought, oh my goodness, all of our patients are going to die.
You know, you heard in the beginning that the homosexuals were getting sick and they didn't know why, and they were trying to blame it on different things. And then there was a smattering of, gee, maybe it went through the blood products. And I had like a in my stomach, and I said, wait a second. If it's in their blood, it's going to be in Matthew's system soon.
Although it seemed to me that this could be bloodborne, nobody could really conceive of the fact that it might kill the majority of individuals that it infected. There was no precedent at all for that in the hemophilia community.
It seemed implausible to many in the scientific community that a new deadly plague would emerge in 1982. But CDC epidemiologists trained to detect disease patterns saw a lethal pandemic spreading through blood that needed to be stopped. They called an emergency meeting in January 1983. They gathered together leaders from FDA, activist groups, and the blood industry.
Doctors and scientists are hoping to come away from this meeting with one thing, and that is a list of preventive measures.
It was an unprecedented opportunity, a room full of decision makers. Bruce Abbott presented the facts. 800 people had AIDS. 8 of those were hemophiliacs, and up to 50% of the hemophilia population showed symptoms. The evidence strongly suggested the U.S. blood supply was contaminated.
I think very few of the physicians had the kind of background or knowledge base to understand and appreciate what the epidemiologists were saying. And if we don't see hard data and the kind of clinical data we understand, we better do nothing different. I think they really didn't get it.
To change national blood policy based on just 8 confirmed hemophilia cases, many felt was premature.
It was a great exercise in mass denial. and the enormous tragedy of all those really smart people being in the same room was that AIDS was firmly into the blood supply. It was in these products. Thousands of people were gonna die, and nothing was gonna be done.
This meeting was probably the most depressing meeting. They didn't want to make any decisions. They just wanted to see more data. And it was putting these patients in the abstract of numbers rather than human beings that were being lost to this condition.
I was first diagnosed with a mild case of hemophilia when I was about 17 years old. In 1983, I was an ordained Presbyterian minister, just newly graduated from seminary, had a wife, had a son, and day after graduation, I had my daughter. And at that time, I was playing basketball and landed the wrong way on someone's foot and broke my ankle. So I thought, well, I better go to the emergency room because I have this thing called hemophilia.
A mild hemophiliac, 29-year-old Dana Kuhn had never been treated. 2 months after the CDC meeting, with no changes in blood policy, he was infused with his first ever dose of factor concentrate. No one mentioned AIDS.
I probably got about 3 treatments in all, and throughout the course of 2 days. And about 4 or 5 days later, I started to come down with flu-like symptoms.
Since the AIDS epidemic began, doctors have found the disease in at least 12 hemophiliacs, and what may be symptoms in many others. The unaffected are beginning to worry.
It was alarming, and I would call one of the clinicians, "Don't worry, nobody's getting infected, don't worry about it." And so then I would relax for a while until I read something else again, and then I'd call again and get the same answer.
It is extremely important that hemophiliacs continue to use their much-needed blood clotting factor products because the risk of not using it is greater than the risk of AIDS itself.
It was learned today that at least one hemophiliac patient here in Southern California was given blood plasma from a donor who died of AIDS.
I was trying to be reassuring because truly there wasn't scientific data. It was all sort of circumstantial and put the pieces together. So kind of what's a poor person to do? The answer to that was keep on doing what you're doing.
Because we weren't told to stop, we just figured, hey, rumors are rumors and can't be that bad.
Some countries, fearing AIDS, sought to ban the importation and use of American blood products. But in the US, even as the epidemic grew, little changed.
It was a very chaotic time. It was a time of high emotion, information coming and going quickly. And while all the other information kept changing, one thing that didn't change was that our patients still had hemophilia and they were still bleeding.
With no mandatory FDA recalls, products remained on shelves in patients' homes and doctors' offices.
One night, the doctor called and asked me if I had used certain lot numbers for Brian and for Sean. No one had ever questioned that. So I just told him we used it, and he said, "Oh, don't worry, just keep doing what you're doing. I want you to keep doing what you're doing." I said, "Well, is there a problem?" He said, "No." And that was that.
But there was an alternative. In rare cases, clinics gave patients the choice to switch from factor to the older therapy, cryoprecipitate. Treatment with cryo exposed patients to fewer donors, reducing the risk of AIDS.
Most of our families did choose to go back to cryoprecipitate at that time. Using cryo at home is not as easy as using concentrate at home, but it will stop the bleeding.
Dr. Ratnoff suggested that I would die of AIDS if I didn't switch back to cryo. I simply didn't believe him. And I wasn't willing to give up my lifestyle. I was in medical school working 120 hours a week, and there was no way I could see taking time out, going down to the blood bank and mixing up some cryo.
The vast majority of hemophiliacs had no choice.
The local Red Cross here in Los Angeles was not willing to furnish us with nearly enough cryo to treat the large number of patients we had. And it was logistically not feasible.
Federal action was needed to stop the unfolding crisis. Decisions about blood supply and product recalls were the FDA's jurisdiction.
I was not involved in the regulation of Factor VIII and Factor IX, but certainly if the FDA had convincing evidence that a product was lethal, FDA would rise and stop it. I don't think there's any question about that. But the major question is, when something is going on and it's adverse, but we don't understand it, how hard should we push to get it off the market?
The FDA tended to view their relationship with industry as a collegial relationship. And they weren't professional regulators. They weren't cops. They were scientists. And so there was little pressure brought to bear on industry.
The probable cause of AIDS has been found. We now have a blood test for AIDS, which we hope can be widely available within about 6 months.
With the human immune deficiency virus identified and an HIV test available, the grim accounting in the hemophilia community began.
I went into my doctor's office. She took down one book and she looked up my code number from my testing number. She put that down, and then she opened up another book of loose leaf full of results, and she found my testing number, and she said, "You're positive." And I said, "Do we know what this means?" And she said, "Not yet."
Leo called me on the phone and said, we're both positive. I thought, oh, positive, that's good. It must mean that everything's going to be okay. And then I clarified that with him. And it was just a horrible moment, horrible. At that point, to have your son say that both he and his brother were infected with AIDS.
I knew that I had been treated at least once, that one time, and I said, I just want to eliminate that thought of a risk. I have a family, and I'm concerned about that. So they took the sample of blood, and that came back, and it was positive. It took 3 weeks for it to come back at that time. And so they told me that from now on, any sexual intimacy that you have with your wife, it needs to be with protection.
It turned out that I became infected in 1982. It was a great unknown period of time. I can remember personally thinking, would death come next month? Would it come next year? And that was tough. It was very tough.
As people learned they were infected with HIV, many faced public ostracism.
I remember being in a supermarket and seeing a Life magazine. I could read the cover from 30 feet away, and it said in huge red letters, AIDS, now no one is safe. So I thought, that could go badly for everyone.
Ryan White, the 14-year-old Kokomo, Indiana boy, was banned from school after he contracted AIDS from a blood transfusion for hemophilia.
A week of death threats, bomb scares, and school boycotts ended in a weekend tragedy for the Ray family when a suspicious fire destroyed their home.
A new school day in a new town for Ricky, Robert, and Randy Ray. The three brothers are hemophiliacs, and the entire Ray family has been exposed to AIDS hysteria.
People had to become very secretive. All of a sudden, the whole family is just sort of shutting down and closing in among themselves because they didn't want anybody to know now that their child had hemophilia, because hemophilia meant AIDS.
I definitely knew that I had this big secret that I couldn't tell anyone. At that point, I didn't feel sick, and I didn't look sick, and everything was fine.
When Matthew went on to Cornell University, he decided to confront the stigma of AIDS.
I'm going to go to law school, I'm going to have a career, I'm going to try and live my life as much as I can, as long as I can. And I can make... At that point, I decided to let everybody know that I was HIV positive. And so I went out and started doing safer sex workshops. And it wound up being a great experience. I wound up doing like 200 workshops.
I do think about getting sick, and I do think about losing everything. You know, when your mortality is like right in your face, all of a sudden, like, doing more becomes like an inviting thing. I'd rather try to make a difference.
3 years later, Matthew developed a weakness in his arm and leg. He was diagnosed with PML, an AIDS-related lesion on his brain.
After having all these years of nothing, boom. And he deteriorated really very fast.
I was paralyzed in a wheelchair for like 6 months.
Oh, wow. You were really, you couldn't move.
No, the only thing that was working was like basically my biceps. So I still have like 50% use of my arm and 50% use of my leg, if not less than that. And that part is hard.
Being Matthew, he pulled through. He had to learn how to write, learn how to dress himself. He graduated law school in a wheelchair. He had a girlfriend. She was brave enough to marry him. They were looking forward.
The means to kill HIV infector may have existed all along. When Factor first won FDA approval in the 1960s, scientists knew that heat would kill some viruses found in plasma. But manufacturers had argued that heat would damage the fragile clotting proteins. In 1979, a small German company, Behringwerke, unveiled a factor concentrate they claimed was free of hepatitis, killed by heat.
Behringwerke's breakthrough in Europe was the stimulus that led us to initiate a project at Highland. So the free market system works as it's supposed to work in terms of encouraging people to take initiatives that will benefit, in this case, patients with hemophilia.
So I looked for memos that would say things like, we're very concerned about our patients, you know, we want to fix this problem because the patients are getting hepatitis, but there's none of that. Basically, what you see in the memos is we better get to work because we're going to lose our market share.
We put tremendous efforts behind it, and we're delighted when we were the first ones to reach the market in the United States with such a product.
This process that we're watching is our heat treatment or viral inactivation step for our Factor VIII concentrator. Once it is filled, we then heat the water to 60 degrees centigrade.
For more than a decade, manufacturers had argued that it couldn't be done. Now, it took just 3 years for Highland-Baxter to bring a heat-treated product to market. And within a year, all 3 of its competitors had done the same. Though not entirely effective against hepatitis, Dr. Bruce Evett and colleagues at the CDC wondered if heat would be effective against HIV.
If it did destroy HIV, then the means was at hand to stop the epidemic immediately. And we found that the virus was extremely heat sensitive. The heat treatment was quite simple in the end.
Had these companies aggressively pursued sterilizing their product, cleaning up their product from the time that they knew that patients were being exposed to hepatitis in these products. And had they done it, most hemophiliacs would not have been infected with HIV.
Fortunately, I do believe that using single donor cryo for our children with hemophilia in our center did save some people and many children, because we have a 20% rate of HIV rather than a much higher rate, close to 80%.
Despite the alternatives of cryo and heat-treated factor, the untreated, contaminated product also continued to be sold.
The companies don't recall their unheated product. So there's product that's in pharmacies, in hospitals, in doctors' offices, in patients' homes that is deadly. And there's nothing on the label to tell the doctor or the patient that it's deadly. The companies know it's deadly, and they don't recall it.
And you kept on giving your kids this medicine that was supposed to help them and cure them for hemophilia, and you kept on reinfecting them every time you opened your fridge, and you injected them with AIDS.
The chief regulator of clotting factor companies in this country contacts the companies in 1985 and says, we want you to quietly recall your unheated product so that Congress and the media and the doctors don't know that we, the government, have been lax in making you do this.
I believe it was 1985. We had something like 5 patients die within a week. They all had AIDS infection, and they were all men and young men I had taken care of through thick and thin for years and years. One can't help but feel, what have I done? Or what have I not done? Sins of omission and commission. But to see so many lives snuffed out at once, lives still unfolding, is just devastating.
In 1986, Dana Kuhn's wife Patty was diagnosed with AIDS, unknowingly infected by Dana years earlier.
She took a turn for the worse, and she couldn't talk anymore. And the doctor said she's not going to make it. It just tore me up, and so I had to communicate her through squeezing of hands, and I just told her, you know, that I loved her, and then she would squeeze back that she loved me, and I told her, you know, I'm going to take good care of those kids.
Across the country, the death toll from AIDS was rising. In the hemophilia community, families turned to each other for support.
They began to talk to one another. They compared notes. They got lawyers. And those lawyers, in turn, got them documents that began to show the extent to which they had been victimized.
They learned about the plasma donors, the pooling practices, the possibility of returning to cryoprecipitate, the ignored warnings of the CDC. Over time, the documents were compiled into a volume they named The Trail of AIDS.
The one that really got my attention said, we are highly suspicious that it is in the blood supply. This communication came out in March of '83. I received my infusion of factor March 26, 1983. And I thought, whoa, right then and there, someone should have said to this community, there's a danger here. So I became a man with a mission, and I was going to try to show people that there was negligence here.
It took parents, not only myself, it took a lot of people in this community a long time to put this in your head that doctors, clinics, American Red Cross, the FDA, the government, you sound crazy when you say that everybody knew but you.
By the early 1990s, activists, including Glenn Pierce, began poring through old documents in search of answers. Corporate memos revealed that when companies could no longer sell unheated factor in the U.S., they gathered up unsold stock for export and sale overseas.
It was shocking that they shipped product overseas that they knew was contaminated with a lethal virus. It told me that industry didn't necessarily have our best interests at heart. It told me that the FDA didn't necessarily maintain a good watchdog role over industry, and that the system really needed to change.
The hemophilia community changed a lot in the 1980s and 1990s, from a fairly quiet, docile group of individuals to a really strong and vocal organization.
My husband will die of AIDS because they did not want to spend the money to clean this product up. My husband was sold out for $1. He was murdered.
Their evidence reached the new U.S. Secretary of Health and Human Services, Donna Shalala. She asked the Institute of Medicine, an independent group of scientists, to study how HIV had so thoroughly breached the nation's blood supply. Dana Kuhn went to Washington and led the Institute of Medicine through the trail of AIDS.
This was day in, day out, what we had to do. We knew the truth, and we had to make the truth known.
Our entire public health system missed opportunities to intervene and to save lives. Blood safety must never again be handled as a secondary issue. I am elevating it to the highest level of the department.
Secretary Shalala formed a cabinet-level advisory committee charged with safeguarding the nation's blood supply. Dana Kuhn, Glenn Pierce, and other hemophiliacs were asked to serve. For the first time, those most reliant on blood could help protect it. Hemophilia advocates then turned their attention to factor production. They insisted on more stringent regulation from the FDA. Manufacturers responded with their own industry-wide safety standards that today exceed FDA guidelines.
These changes would not have occurred without patient advocacy. It's only when people start raising questions and demanding answers, and then asking for change, and if they don't get it, demanding change, that change happens.
But their victories were overshadowed by loss. Throughout the early 1990s, AIDS claimed the lives of hemophiliacs at a rate of 1 per day.
It's a very helpless feeling when you watch your children become ill and can't do too much about it, can't do really anything about it. It was just an unbelievably tough existence. It was very hard to see them just go down. They loved life so much, so it was difficult, very difficult.
I felt like I had poured all my energy into hemophilia for them to be able to be teenagers and young men and be able to survive hemophilia. And then AIDS comes along, and you felt like, so what do I do now? Because I can't fix this. I cannot fix this. I can't sit on the bed and have talks with my son at maybe 15 and 16 years old who's going to ask me, how much longer do I have, Mom?
Stop the red tape!
Faced with two catastrophically expensive diseases, the community demanded government restitution for the nation's failure to protect them. It took 6 years, but eventually every HIV-infected hemophiliac was paid $100,000. Soon after, in response to lawsuits filed by families, the 4 U.S. drug companies also agreed to pay $100,000 to each infected individual. It was roughly what they earned from one child's treatment for a year.
We have a compassionate payment. They did not acknowledge they did anything wrong. It was compassionately done. Canada is having criminal trials. France put 2 doctors in prison. The Japanese made them bow down to the moms and apologize. Do you know of any country that gives a compassionate payment of $100,000 to 7,500 people if they didn't do anything wrong?
I would never say that these were decisions that were made by evil people, but they were made by people with the bottom line in mind. And that was ultimately the failure of the entire system.
Hemophilia advocates had forever changed the nation's handling of blood and blood products. But the weight of past decisions would continue to have devastating consequences.
I had a very exciting job. I finally felt I was in a place where I could bring all my skills together. And then 6 years ago, I felt like I had Clorox in my veins, that I was sick in some very deep way. The doctors realized, wow, he's not getting sick with HIV, but he is getting sick from hepatitis.
Several forms of hepatitis had been present in Factor from the beginning. Hepatitis B had been manageable, and hepatitis C appeared mild.
The cirrhosis was slowing down all of my systems. I was starting to become overwhelmingly tired and experiencing brain fog. And then just have drifted steadily downward in terms of my capacity since then.
Well, it turns out now that the major killer of patients with hemophilia will be hepatitis C. And it was only within the last few years have we begun to understand the long-term complications.
Hepatitis C began to take its toll on me. And every year in the 2000s became a little worse. But I was surprised last October to receive a call telling me that they had a liver for me. So I was transplanted. It was a major operation. The absolutely amazing thing is that within 24 hours of this liver transplant, I no longer had hemophilia. I was cured because factor VIII is made in the liver. Therefore, a liver transplant will be curative. That was awesome and really weird.
Now, with his AIDS under control, Matthew Kleiner and his wife Jenny were exploring a new procedure that would allow them to safely start a family.
Oh, look, the food is ready.
He was always told, take your cocktail, live to 30, you'll be home free.
Just settled so quickly.
Hepatitis was never mentioned. Never. It was never discussed. It was always AIDS, 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 AIDS. It was never hepatitis. And he really got sick at the worst possible time. His wife was pregnant. He made sure they had a great apartment. He found her a nanny. He was so excited about having kids.
January 1st, 2003, they became parents to 2 girls and a boy. By the 3rd week of January, he was jaundiced. His liver was really getting bad.
And he got sicker and sicker and sicker. And one doctor said, oh, don't worry, we can give him a transplant. So we were holding on to that for dear life.
One day, Matthew's doctor said, I'd like to speak to you, Mr. Kleiner. This is very serious. And he told us that the problem was that if he had a liver transplant, they'd have to reduce his immune system so he wouldn't reject the liver. And then his PML and his HIV would kill him anyhow. So he was not a good risk. The doctor left the room. And for the first time ever, and something no parent should ever try to have to deal with, my son cried out that he was going to die and that he wanted to know who was going to take care of his wife and children.
That's a rare tragedy and a rare irony that people could have come so close to being home free, and then because of a decision made about money, they were denied that and people died.
I think the hardest thing for me personally was not being able to convince people what was happening when it was happening. Yeah. And I think that was very difficult.
More and more of our products, our pharmaceutical products, our medicines are being made overseas in factories that are rarely, if ever, inspected by the Food and Drug Administration. There isn't the money, there isn't the will. It becomes so much more urgent and difficult to regulate. And based on what I see from this case, I really wonder if our system is up to it. I really think it might not be.